Today on Man Up, our guest host will be Donny Beaver, and we'll have a conversation about healthcare.
Man Up is a series that challenges men to become strong, unique, discipled followers of Jesus. Troy Ferguson, Sean Tice, Victor Thomas, and today's guest host is Donny Beaver. Welcome to Man Up.
I read a story last week about a young man who was living on a college campus. This young man, he had different classes, and he would load his backpack and have to go hours carrying this heavy backpack all day long, here and there, and it would sometimes hurt his back. And the young man would get so upset about this that one time the buckle even broke on the backpack, and he was totally frustrated. And you know, the story brought a thought to my mind that sometimes there's just burdens that are too heavy for us to carry. And God doesn't want us burdened with those types of things because it brings all kinds of anger and bitterness. Anger and bitterness are things that will erode the container. It's like an acid. God wants to free us from those things by giving forgiveness. There's a lot of people who go through this world that they've suffered hurts. It's time to be loose from those bondage. And I get it. Sometimes the deeper the hurt, it takes longer to get over those pains. It reminds me of a story in the Bible where Jacob and Esau, two brothers, had a falling out. It was so to the point where the one brother wanted to kill the other brother. And it took years. They separated. And it took years for them to forgive one another. Esau finally learned how to let go of his anger. And Jacob, over that period of time, learned how to learn from his mistakes and the hurt that he caused others. Sometimes it takes time to get past those wounds. But I hope that if there's anybody that you haven't forgiven, God wants you to forgive that person. How does unforgiveness affect your relationship with God? Learn how to forgive others as we have been forgiven by God. That's the message for today. Stay tuned for this episode of Man Up.
Impact Productions, a multi-layer technology company providing on-site, online, and in-studio video services. Contact Impact Productions to capture your story.
Welcome back to the show. And a big welcome to our brother and friend, Donny Beaver. Thanks for coming on today.
It's good to be here. Thanks for having me.
Yeah, absolutely. Hey, could you give a brief background to our viewers who may not know you?
Yeah, I'm, as I like to say, I'm a devoted follower of Jesus, cleverly disguised as a family guy and a serial entrepreneur. So I've spent my whole life trying to build businesses from scratch in areas that I was scratching my head on, and just followed a series of those for 50 years. It's hard to believe, and just usually I'm halfway decent at the startup phase till we get it up and running, and either we propel it forward or shoot it in the head. That's usually my job as judge, jury, and executioner. So it's. I'm sort of lost track of how many of those we've been through, but it's God always has another one. Just as soon as I'm getting the momentum going, I'm ready to hand off to somebody else. He has another one ready for me. So,
amen.
So Donny, we're going to be talking about something like Gloria Gates Care and so forth today. Can you talk a little bit about the motivation, your connection first of all, and then the motivation behind this?
Yeah, thank you. I didn't know I was being motivated to follow this path. And it was a series of events since the 1970s that started to build in the back of my mind at first, and then became a little bit more forward and eventually popped. And it was the first thing was I was so proud to be able to offer health care to my first group of employees in the mid-1970s. And it was $79 a month for a single man for Blue Cross Blue Shield. I say man, it was men and women. And for a family of four, it was like $129 a month. And it was full coverage, no co-pays, no deductibles. I mean, imagine that. And it was affordable. In 1975, healthcare in America was 7% of gross domestic product. This year it's 21% of GDP.
Wow.
So it's gone up about 3 times faster than it should have. And so that was always eating away at me, because every year it went from a few $1,000s to tens of thousands to hundreds of thousands to eventually millions of dollars that we were steering in our various companies through the health insurance system. And it wasn't going directly for care, it was going for the insurance on maybe you needed care. I mean, if you really stop and think about it, you were talking about the sewer line. You know, you're doing it in case you need it. You're not doing it because you know 100% certain you're going to need it. And so that was frustrating for me. And then, but it really started, my wife had a very difficult 12 or 13 years from the late 80s to the early 2000s. And we went all over the country trying to get her problem solved, much like you're going through with Nene right now. And we were everywhere, and had the best insurance, but we couldn't crack the code. The insurance didn't guarantee that we were going to get the care we needed. And finally, we just had to take control of our own journey. We had to stop relying on did the insurance company say we could or couldn't do it. And we finally, God led us through a path, and thankfully in 2000 she started to get better, and by 2002 she was completely healed. And so, but that had built up in there too. And then starting in the very next year, my father-in-law was early stages dementia, and he was my best buddy. And so I watched that slow decline, and how no matter which way we turned, nobody seemed to have any answers. And then eventually we had to get him into full-time care. There were some debacles there. Even though he was losing his mind, his physical health was perfect, and then all of a sudden he just like died. And it wasn't a heart attack, it wasn't a stroke, and so we often wondered what was going on, but in God's mercy. And then literally the next day my mom died. So we had 2 funerals that week. My mom went in the hospital to have a valve replacement. The valve replacement worked, but she got MRSA while she was in the hospital, and she never returned home. So we sent her in to fix something that they fixed, and they brought something else in that killed her. And then 4 years later, my dad had a little fall in the backyard. They determined that he had a mini stroke, got him out of the hospital into rehab. In rehab, he got bladder infections, which turned into sepsis, which eventually killed him. So it's like every time we put him into somebody's care, at an institutional setting, and there's so many great people working there. But the administrative burdens and the confusion that goes on, if you've been in an emergency department lately, I was 3 weeks ago, I'm laying on a gurney in the hallway. So many good people around, but just so much stuff. And you know, every time they come in, they want you to tell you your name, which knee am I going to cut off? No, but you know, they have to affirm all this stuff, and then in 2021, my wife Pam, picture of health, you knew that, and in two weeks she went from 100% healthy to heaven. And it was the same thing. We got into a hospital system. From what my friend and partner, Dr. Zane Gates, tells me, they couldn't have done anything more wrong in the protocols that she was offered, and she was going very quickly. So that's sort of, all that stuff was building up, and then I became she was then 89-year-old mother-in-law. I became her primary caregiver, and she was in a bad accident 8 months after Pam passed. Just about died, and so as she was recovering, I had the privilege of taking her to see Dr. Gates every week or two, and started to ask him, why is your practice different? He told me that he should have lost between 400 and 500 patients during COVID. He only lost 4 total. What did you do differently? Well, I didn't follow the conventional wisdom. I did my own homework. I changed the protocol, and literally we set up a drive-through treatment center because nobody wanted to come inside, nobody wanted to take the masks off, and so he had this mirror. He should have been like the case history for the rest of the country, because this was early. This was March, April, May of 2020 that he was saving people who were on Medicaid and Medicare,
Yeah.
who were the least healthy folks, COPD, A1C, all kinds of other things wrong with them, ones that should have just been really taken down. And so as I heard the story, it's like, wow, that's an amazing, we both know the Holy Spirit's behind this, and we share that faith, and I just said, why hasn't this business prospered and grown? And he said, well, I have partners that want to take it in a different direction than Medicaid, and I want to take it in that direction, and unfortunately they write the checks, I don't. And so it's like, well, maybe we could team up, and so that's how it all came together.
Donny, you mentioned healthcare costs. Why are they so expensive?
I'll answer that with a couple questions, and you guys can answer the questions. You have insurance for what reason? Any kind of insurance. What's a normal reason you have insurance?
Just in case.
Just in case.
Just in
right,
case.
Right. So how often do you use your car insurance?
Rarely.
Really, yeah.
Yeah.
Homeowners?
Yeah. Rarely.
Never. I've never had a need.
How about your life insurance?
Not yet.
Not yet.
Right. Because insurance
Yeah.
was designed for two reasons and two reasons alone. Random loss, but it had to be affordable. And if you can insure a $40,000 car for $600 a year, you're gonna take that chance and buy that insurance, because it's $600 a year. It's going to take you a lifetime almost to spend all that money to replace that car. And it's obviously the same with life insurance. A 35-year-old person in good health can buy a $1 million life insurance policy for $700 a year. Why not? In case something catastrophic happens. How often do you use your health care insurance?
Regularly.
Right.
Yeah.
It violates those two things. It's not random, it's predictable, and it's become not affordable. This year, the average family of four will pay about $29,000 all in for a family of four, and there's only a 4% chance that you'll use $7,000 of that. And and the reason it's expensive is because the insurance companies have evolved to the place where they make their money on holding on to the money as long as they can. And so what do they do to hold on to the money as long as they can? They make it hard for you to get care. They make the doctor have to write excuses for you and beg for permission. It's called prior authorization to even do an extra test on you. And so that administrative cost back and forth costs the U.S. over $1 trillion a year. $1 trillion bucks, how much is that? If you made $1 million bucks a year for 1 million years, you'd have $1 trillion bucks. That's what we waste every year on back and forth. And Dr. Gates designed a system to eliminate that, and you just buy care directly from us.
Is that the membership?
Yeah, it's a membership
that point?
and we'll talk about that a little later, but our membership is either you can buy it directly from us, or it's wrapped inside of other insurance products for the catastrophic stuff, because we don't cover the catastrophic. We cover the regular, normal
Right.
stuff that you run into every day.
And that's how you, to solve that problem of the high cost.
Right, because we eliminate, we don't have to ask for permission, we just do what the doctor thinks is right.
Wow. We see Dr. Gates on billboards everywhere in our community. Is he your only provider?
Yeah, it's funny because when we got started, it was Dr. Gates who was spending about 40% of his time seeing patients, and the other 60% of his time just constantly questioning the system and trying to tweak his business model. And we had the equivalent of 1.5 other full-time providers who were nurse practitioner and a semi-retired doctor. Today we have 11 providers here in Blair County in our Bellwood and Tyrone offices. So that's expanded substantially. But that's the tip of the iceberg. Behind each provider, there's 4 other people doing stuff that's vital to your health. So we run our own lab, so we can get your lab results right away. We have dietitians that if you're having trouble with either weight or your A1C is out of control and you want to get it back in control, you don't have to get a prescription for that. You literally walk down the hall and we'll sit down with you and design a meal plan that's attractive, affordable. We have a full-time pharmacist on staff. We have all the acute medications you need. We have our own physical therapy department. So if you come in with a hitch in your giddy up, even before we send you for an x-ray, we send you down for an eval with a physical therapist. You can start that day. And there's no copay, no deductible for it. We have, as you know, as Paul, or as the book of Hebrews says, since we're surrounded by such a great cloud of witnesses, that's what we've done, is we've assembled this into practically a one-stop shop. Right now, we still have some partners in the community, 611 MRI that does our MRIs and CTs for us, but just about everything else we do in-house. So when you get there, we don't even let you go until we know for sure what direction. We don't want to send you to the hospital. That's the one thing we don't want to do, unless you absolutely.
Sure.
Yeah. Wow.
We have some more questions. We have to pay the bills. Can you stick around for a minute?
I can.
All right. We'll be right back.
This segment is brought to you by Harry's Construction, whose motto is, "If you can dream it, we can create it." They are the kitchen and bath design experts, so call Harry's Construction for all your remodeling needs.
Welcome back. Sean, I believe you had some questions for Donny.
You know, Donny, since there are no copays or deductibles, do you even have to bill your patients?
No, that's the wonderful thing about this, is we simply, in the way we administer our billing, we simply put in your medical record the stuff we did, which you have access to, but because you've already paid in advance, it's a subscription for a service that we guarantee, just like a gym. If you join the gym, you want to come 20 times a day, that's fine. You want to camp out there, it's fine. You've paid your, so we don't have any complicated billing or anything like that.
Oh, wow.
You know, so let's get down to what it really matters. What are the health outcomes that you've seen?
One of the things, because healthcare has become so expensive and inaccessible, people wait until it's too late.
Yeah.
And that's where it gets super expensive. And so the way they measure it in the insurance industry is what they call a medical expense ratio, which basically says for every dollar the insurance company gets, how much do they have to spend of that dollar on care? And the government that sends them Medicaid and Medicare money says, you got to spend at least 85 cents of that dollar on care, and you can spend 15 cents of that dollar on administrative costs and other costs. So, but with our population, especially the Medicaid population, the insurance company was spending $1.29 for every buck they got. So they were losing 29%. And so Dr. Gates got about 1,000 patients. He started out with 8 years ago. And his main charge was to lower the expenses on one hand, keep them out of the hospital on the other hand. Now, how do you spend less and do more, right? Well, we know that if you put it in the government's hands, that's not going to happen. But you put it in a private individual's hands, whose name and reputation is on the line, who lays awake at night dreaming up ways. He dreamed up ways. And so from 8 years ago to 2 years ago, he helped lower the medical expense ratio from the high 120s, losing 29% of the dollars that they were spending, down to the low 90s. So they're actually making money on that patient population. And health outcomes, we're still probably a half a decade away from knowing longevity stuff, but anecdotally, it looks like our members' lives are actually improving in not just their life expectancy, but their health expectancy. You know, there's one thing to be living, there's another thing to be healthy. And so that's how we measure. So, you know, we're catching people with A1C earlier, getting them to eat healthier before they lose feeling in their toes and have to have them amputated. So the outcomes have been tremendous.
Wow.
I heard you say you started with just Medicaid and Medicare only. Is that correct?
Correct.
And I believe Dr. Gates wanted to help the demographic just like his mother,
Right.
Gloria.
That was the original focus.
And is that where you're at now?
So that's where we started, and it was 100% of our business when we started in 2024. By the end of this year, it'll be about 75% of our business, because all of my friends and family and Dr. Gates's acquaintances have been saying, I don't qualify for Medicaid or Medicare. Can you help us? And so we started offering it to individuals, families, and businesses just in August.
Oh, okay.
And it's become 25% of our business already.
Oh, okay.
Wow. Wow.
Now that was thanks to his former partners decided to focus their efforts in Florida, and when we heard that, we said, do you mind if we take over your employers here in Blair County, because they're not going to have anywhere else to go. So we were blessed with getting the Altoona School District and the Blair County employees and Thompson's Pharmacy and Value Drug. So we got a real boost to that business because his former partners said, hey, look, why don't you take that? So we're grateful for that.
So even if people don't qualify for Medicaid or Medicare, they're not out of luck with you. They can still get connected with you.
Yeah.
You take care of
They're, so you literally, and we had 6 or 7 individuals yesterday just walk in off the street, had heard about it, and basically it was like joining the gym. They gave us their credit card. We set them up for monthly billing, and boom. Now, when they do it, if they do it after the 15th of the month, their service doesn't kick in until the beginning of the next month.
Okay.
But nonetheless, so we can do it with individuals. And what's really amazing to me, I have several people in the office come in every day with a Starbucks. It's a tall, but it's not a grande, right? A latte. How much was that? It was $5.85. I can get you a Gloria Gates Care membership for less than that. So give up your latte, join us, stay healthier, and
Wow.
yeah.
So at Gloria Gates, you said that people walk right in off the street, and you have employees that can assist them?
Yes,
With-
good question. So we have a team who are experts in basically, first of all, they assess, do you know if you qualify for Medicaid? Because maybe you do. So they walk them through that step first, ask them about 10 or 20 questions, and they may qualify for Medicaid, in which case they don't have to dig into their pocket at all. If they don't qualify for Medicaid or Medicare, they should know if they qualify for Medicare, because people have been pestering them for 3 years before they turn 65. But if they don't, then basically about 50% of adults between the ages of 18 and 64 would fall into that I don't qualify for Medicaid or Medicare, in which case then we show them how to sign up for our direct primary care.
With this model shift, what do you think the insurance industry is going to look like in the next 5 years?
The prediction right now, because we're such a small part, we represent, you know how many angels on the head of a pin. We are such a small part. If our model or something like it doesn't get adopted, in 5 years, average health care will be great for a family affordable will be greater than the household income. So closer to $50,000 a year.
I know Dr. Gates was once quoted as saying, a card doesn't equal care.
Right.
How would you elaborate on that?
Well, basically, yeah, so if you have an insurance card, that says you have insurance. It doesn't say you have care. Care equals care. And care we start at the opposite end of the spectrum from insurance. Insurance design plans that they believe they can make money at and they can sell, and then you have to go through the insurance to get to the care. And the care is like way down in here. We design care, and you can get to us through many avenues right away, either directly or through an insurance product, but the care comes first and the insurance comes later. And theoretically, we already have cases where we know that we can save 10, 20, 30% for people and employers now, and we think we can get better at that with time.
Wow. You mentioned early on when you started your businesses, you could provide care as a business for your people for a great cost. So this isn't just something for individuals or families to do, but are there businesses taking care of their people through you as well with this?
Yeah, so as I pointed before, our Zane's former partners, when they decided to move out of the market, we were able to pick up 31 businesses here in Blair County. That started in late September. Since then, because so many people know us and the word's gotten on the street, because we haven't really advertised it yet, we now have about 30 businesses that were in some stage of the process, we call it the funnel, where they are exploring. And the great thing is, the smallest businesses we're talking to have 2 employees. The biggest ones have more than 1,000. Wow. So there's really no place on the spec. The 1,000 employee place takes a long time because there's a lot of complexity with 1,000 people. Under 50 employees, we can get you going quick.
Final word, Sean.
I just think it's a great plan. I mean, honestly, the membership model, I'm self-pay personally.
Right.
And so it's very intriguing.
Yeah.
Honestly.
Awesome.
Yeah, I love whenever new innovative ways to do things that have been around for years come about that's going to improve life and the well-being of people. And this is remarkable. And I think people are still like, well, wait a second, that doesn't make sense because it doesn't fit my mentality. Right. And it's so different. So it's probably still a mind shift for people.
It's a big mind shift. And, you know, when I think of the real motive behind this, when Jesus is telling about his disciples how he's separating the sheep from the goats, and when I was sick, you took care of me. When I was in prison, you visited me. And they said, when did we do that for you, Lord? I don't remember that. And he says, as much as you've done it for the least of these. And the commission out here on this wall is our commission. You know, we've been grafted in, and we're doing this because this is what we want to be able to present to Jesus when we stand before him. And it happens to be a decent business idea because he owns the cattle on 1,000 hills.
Indeed.
And the wealth in every mine.
That's right. That's right.
I think that's a great place to end.
Yeah.
Donnie, thank you for coming on today. Thank you for tuning in today. Join us next week on Man Up.
Next time on Man Up, we'll have Dr. Richard Cox.
As a family that's serving all over the world, I'd naturally assume that if God was calling me to be a missionary, I would be serving in some remote village in Africa. And I had a passion for Africa, and my dad transitioned from being a pastor to missionaries in Africa right before I turned 16, and I loved it. Africa, in my opinion, is a magical place. I was ready to spend my entire life there.
All that and more next time on Man Up.
When it's time for a new roof, Champion Roofing is your best choice. We're a certified award-winning roofing contractor, meaning your roof is done right the first time. Call today.
Champion Roofing, we're the solution.